What's up, YouTube family? I haven't seen y'all in a minute. You know why? Facebook. Y'all should think about it. It sucks. Don't do it. I thought I'd try something different because we're doing something different today, which is garage talk. I don't know if that's a thing. I'm between two ferns, just like Zach Galifianakis, which is important to me. Come on in. Let's see if we got one live viewer. That's a difference already between no, 12 people. So my lovely assistant Victoria is working on figuring out how to look at the comments, and she is going to read some of these. Cali says garage talk. That's right. So I'm in my garage. We are in the final stages of our move to California. The studio equipment is arriving. September 1st, it's go live full Cali, and Zach already wants to talk about testosterone and trenbolone. I know nothing about trenbolone. I know a thing or two about testosterone. I mean, just look, bald. You require testosterone for male pattern baldness, which is why if women develop alopecia or hair loss, you want to consider, do they have something that is producing testosterone at high levels, or are there other causes? There's a whole workup. Look, people, I'm not an endocrinologist, okay? I'm a general internist / hospitalist. What do we got, Victoria? Can you see the comments?
I can. So Tony asked, Z, what would you like to see improvement on when pre-hospital brings you patients?
Great question. So Tony's asking about emergency medical services, and they come and they bring you patients. Now, this is a real struggle, guys, because a lot of the emergency docs are like, and the nurses, they treat the EMS not so good. And then a lot of them treat them like the colleagues and compatriots that they are. And so asking the question, what can we do better to package up these patients and hand them off to you in the ER so that it's helpful, is a great way to start a dialogue if people are listening. And I would hope that we start to have these dialogues, because frontline paramedics, EMS workers, people who are talking about things like community paramedicine, where it's really part of the whole continuum of care. You guys are right there on the front lines, seeing patients in their homes, in the situation, at the scene. That information is invaluable, but knowing what information matters, knowing how to package it in a way that it's going to be received appropriately by the staff in the emergency department, who are running around like crazy and have a, Ethernet speed transmission of data, it's very tough to do. So we may have to just do a specific show on that.
So Silva wants to know what your thoughts are on the vegan diet.
Silva wants to know what my thoughts are on the vegan diet. What could possibly go wrong? By the way, this is Victoria. Heyo.
Hi.
She is not officially started. That's why I don't want to show her, because I'm not paying her yet. And that's a child labor law, okay? Violation. So here's the thing. The vegan diet, okay, it's funny. So my daughter came up to me, eldest Z-Pup, 11 years old, and said, Daddy, I heard at school today from a friend that she doesn't eat animals because of the way they're treated, and she doesn't even drink milk or dairy products because apparently they keep the cows pregnant and they keep knocking them up all the time so they can make milk, and they put them in small pens, and even chickens, they force them to lay eggs and they never let them have babies, and it's terrible, Daddy. What do we do? And I said, well, let me be honest with you. From a health standpoint, being a vegan is a mixed blessing. It can be very good. Plant-based diets are wonderful, but you have to make sure you get the vitamins, and often that involves supplements, which are not entirely naturally produced, not perfectly regulated. So it's a hard thing to do, especially when you're a young kid, but you can do it. But here's the bottom line. Can you do it? Because you would not be able to eat chicken or eggs or milk or cheese or any of this. And she goes, but I like those things. And I said, therein lies the rub. So how about this? If you don't want to go full vegan, okay, if you just want to be healthy, eat real food. Don't eat those little frickin' Lunchables because they're gross, number one, right? Am I right? Yeah. Number two, they're full of processed crap, refined sugar, all hella garbage and preservatives and stuff that are not good for humans, probably. Although, again, nobody really knows because we're really naive when it comes to nutrition, but probably real whole food. And if you're worried about the treatment of animals, okay, the first thing you can do is make sure you try to go out of your way and spend a little more money, if you can afford it, on ethically treated animals. And the thing, okay, the vegans will say there's no such thing as an ethical butcher or treatment of animals, and that's horse crap, you guys. Humans are omnivores. They've been hunting, gathering from the early days. If you're out there hunting, killing something and eating it, that is a very natural process. What you don't want to do is torture pigs that are very smart, probably smarter than dogs, or at least as smart, in factory farm situations. That's just, we're going to one day wake up and go, we've been committing a kind of a weird holocaust that we never knew, because we didn't realize these creatures are conscious and emotional creatures that suffer. So you can raise an animal very humanely and slaughter it in a way that does not invoke suffering. And in fact, if you believe what many believe, which is animals live in the moment, they're right there in the present moment, unlike humans who are always worried about the past, worried about the future. They're not stressed about dying and all that. You can actually slaughter them and eat them in a way that's absolutely humane. And I'm not sure we do that in the factory farm situation.
So Tanya would like your insight on fatty liver.
Fatty liver? Are you calling me fat, Tanya? Because this interview's over, okay? NASA. That's what it's about. I'm out. What were we talking about? Fatty liver?
Yes, sir.
So fatty liver, or there's several variants of this. And what we're seeing more and more, so it's infiltration of fat, adipose, into the liver tissue. Now, in the old days, you would see fatty liver in what situation? Give a guess, Victoria. What situation might you see fatty liver in?
Someone that's old.
Someone's that's old, but they have to have done some things. What is a typical thing we think about when liver is involved? Now, you guys should know Victoria has no medical background whatsoever, but she has common sense. So when we talk about liver disease, that guy destroyed his liver. Mm-hmm. What do we often think about?
Probably alcohol.
Oh, that's
drugs.
it. Drugs, alcohol. Typically alcohol, which is the worst drug on the planet. So alcohol was the big cause of fatty liver. So alcoholic fatty liver, so on and so on and so on. But now what we're seeing is an epidemic of NAFLD, non-alcoholic fatty liver disease, NAFLD. And we're seeing that more and more because of the increase in diabetes, prediabetes, metabolic syndrome, because why? We eat a shitty standard American diet that's processed food, refined carbohydrates, and drinking calories in the form of soda, not exercising. So what happens, the liver processes sugars like fructose, and if it's overwhelmed, it starts filling up liver with fat. And that can cause cirrhosis, which is scarring of the liver, which can cause liver failure and death or transplant requirement. So why steal a transplant from someone who has autoimmune disease or some other thing when you can prevent it by not eating like shit? That's my answer on fatty liver disease.
Okay, Zach would like to know, is vet medicine, B12, antibiotics the same for humans? Just different bottles?
Ooh, what a good question, man. So they are good questions. You know what? I gotta say this. I'm used to going live on Facebook, and I get the same shit every day. And I'm starting to think YouTube is a place to be, because there's 100 people here asking really freaking good questions. So you have to ask my pharmacy colleagues, but many have told me that they're very similar, the drugs. And that's why there's a lot of poaching. Like if you get your doggy Dilaudid or Ativan or whatever, the doggy Ativan, the humans might steal that. Now that doesn't mean you give your dog human drugs, and it doesn't mean you give your human doggy drugs, but there is a good deal, let's just say, I think, of cross-utility in theory, but I'm gonna defer to my pharmacy colleagues on that. Now, one question that scrolled up I saw earlier relating to fatty liver, what is NASH? What about NASH? NASH is non-alcoholic steatohepatitis, which is another way of saying non-alcoholic fatty liver. All right, what other questions we got?
I think this one's trending. Tanya would like to know about keto, as would I.
Oh, you people and your keto. All right, so I've talked about this before, I'll talk about it again. So, and just because I'm bald and brown, I'm not Peter Attia, okay? Peter Attia was on our show. He's like the keto expert and a really smart guy. So the keto diet is all the rage right now. I actually did, full disclosure, I did 8 months of keto a few years back and talked about it. I lost a shit ton of fat So I don't have a whole lot of weight to lose, but I lost fat, got like a six pack for a minute, was pretty awake and alert and enjoying it. But what I found with the diet, which is, and you guys need to understand what this is. So the keto diet, the true keto diet means you are restricting your carbohydrate intake to less than typically 50 or 20 grams a day. That is very hard to do. What do you replace the calories with? In a pure keto diet, you can't even replace those calories with just protein, because if you eat too much protein, you actually start producing through the liver sugar, which then causes insulin secretion, which then knocks you out of ketosis. Ketone bodies, ketones are produced when fat is burned in the absence of insulin. And the way you lower your insulin levels is by not eating carbohydrates that trigger insulin release or high amounts of protein. So what do you have to eat? Like 80% of your diet has to come, calories have to come from fat. That's really hard to do if you don't know what you're doing. So a lot of people make the mistake of just eating like hamburgers and bacon and all this, but there's so much protein, they get knocked out of ketosis anyways. So to do it right, you really have to pay attention. It's very hard to do. You're not gonna be chilling with your family, having fun dinners at the pizza place. You are gonna F up a lot, and it's going to 100% be hard to do. Oh, is my mic staticky? Oh, you know what it is? Hang on. It's this. See, this is my, yeah. Give her a thanks for actually reading comments, because I don't read your shit, all right? You don't know me, microphone people. I don't know if I can fix this. We're gonna try. What other questions we have?
So I really like this one. Christina asks for advice you would give to a pre-med student in their senior year.
Advice I would give to a pre-med student, and by the way, shoot her some comments as to whether the mic's better, in their senior year. Okay, I was a pre-med at UC Berkeley. I don't need to say anymore. That shit was so atrocious. So you have probably 800 pre-meds at UC Berkeley. At least that's how it was in the 90s, when the 9 when I was coming up in the game. And let me tell you, it is a dog-eat-dog kind of shitstorm. So the way you stand out in these applications, yeah, you got to do decent on the MCAT. I did decent on the MCAT. Yeah, you got to have decent grades. I had decent grades, okay? Was it perfect? No. I'm at UC Berkeley competing against 4.0s with perfect 36s on their MCATs, and here I am with whatever I had, and I was like, shit. So the way, my advice is, you got to stand out. And the way you stand out is you do some shit that's crazy. I mean, like, I'm talking kill a homeless guy, hide the body, get away with the crime, and then brag about it in your personal statement. If you can kill a hobo and get away with it, you deserve to go to medical school, because you're clever. You're wily as shit, all right? I'm joking, I think, but what I am saying is do something interesting. So this is what I did to overcome the fact that I didn't have a 4.0, because you know why? Because my sophomore year, all right, which was my second year, because I ended up graduating in 3 years because I had a shit ton of AP credits, which also made me stand out. Graduating Berkeley in 3 years with a major in molecular biology and a minor in music, UCSF was like, oh, that's interesting. You're not like every other four-year student. Well, in my sophomore year, I decided, oh, you know what? Now's the time to smoke hella weed, drop acid, hang out with my derelict liberal arts roommates who don't, have zero responsibility, because they're just like getting high and, oh, thanks for the $5, Magooty. They're just getting hella high, and I'm like, I can get hella high too. So never went to class. We're talking physics, OChem, I forget what else I was doing. So I got B's in all those, and apparently I hadn't really gotten a B in my life prior to that point, except for French, because the teacher hated me, okay? She was like, écoutez et répétez, and I was like, you répétez. It didn't go well. So to overcome that screwing around period, which I recovered from, I had to graduate in 3 years, and then I did research in my fourth year in a lab where I actually published a paper on fruit fly shit, and that got their attention. So what I'm trying to say is, if your grades and your MCATs aren't perfect, there's so much other shit you can do. The other thing to remember is, this is my advice to all pre-meds. You think you want to be a doctor? Are you sure? Because if there's anything else in your life that you would rather do, you better explore that first. Don't do like what I did, where I'm like, I want to be a doctor, but I also want to be a rock star and a comedian, and I want to teach. Well, you better try to do that. Because if that's your passion, do that first. If medicine's your passion, then go for it, full bore, and you can do other things on the side. But you better make sure medicine's your passion. What do we got? We've raised $5 here.
Diddy would like to know your advice on growing weed in your garage with your plants.
So very good advice, very good question. All right, this is the thing. We got some plants here. We got our grow light. It's not a grow light, it's a movie light. If you're trying to grow, you're gonna need high pressure sodium for the blooming, flowering phase and metal halide for the growth phase. Now, let me just tell you one thing. I have no idea what I'm talking about because that knowledge is from the 90s. Currently, I'm sure they're using LEDs, and also currently, here's a little secret. The shit's legal in like almost every state that matters, right? Just go buy it, don't grow it. That's dumb. Go buy some regulated taxed weed. Let them use the tax money to buy books in school or whatever they're doing with it. And by the way, if you think weed is harmless, and I was a user back in the day, it's not. It can unmask a tendency to psychosis. It can lead to cannabis hyperemesis syndrome. It is not this wonderful natural cure-all. And I'm telling you as someone who used to like to get high. And even now, if you were to give me a joint, I'd be like, I'm not gonna say no because it's kind of fun, but it has downside. It's a drug like anything else, and anyone who tells you otherwise is trying to sell you something. I don't know.
Tanja asks, thoughts on CBD when you're struggling with anxiety and post-transplant pain? That is RX only, the nasty Tylenol.
Very good question. So what do I think about CBD cannabidiol, which is the non-psychoactive component of marijuana, the cannabis plant? I did a show on this. The evidence does not speak highly for CBD oil. That being said, it does interact with certain medications. So if you're post-transplant and you're using CBD, you are probably on drugs like tacrolimus and other drugs that affect your P450 system in your liver. CBD can actually cause liver damage when it affects pathways that metabolize through the same route in the liver, and many people don't know this, so it can be dangerous. Now, that being said, assuming you get the okay from your doctor or your pharmacist to try it, there's really very little harm. And even if it's a placebo and it helps you, which I think it is a placebo, but great, and I think it does have some anxiolytic component because say what you will, there is no pure CBD really. It's always tainted with a little THC. So you get a little bit high and people find that anxiety decreasing in some cases. I always got more anxious when I got high, but what do I know? Great question.
Sorry for your name, I'm pronouncing it wrong. La Moonjana 64 asks, do you know a difference in the current quality of hospitalists as compared to 10 years ago?
Ooh, do I know the difference in the current quality of hospitalists compared to 10 years ago? I don't know, but I'll say that my suspicion is people who've trained recently are more mindseted to the shift mentality. They are more EHR savvy. They're probably less bedside savvy, probably less good at physical exam, maybe less good at bedside manner, really good at processing large numbers of patients through electronic records faster. But honestly, this is just guesstimation because I'm a grumpy old man. The truth is I have no idea. I would say that the colleagues I've worked with are very, very good. So again, as the field has grown, a lot of science has come up around it too. There's a whole quality improvement science associated with hospital medicine that's become mature and is continuing to mature. So it's a great field. Highly recommend people who are interested in that to pursue it.
Vicky Snickers asks, is there a relationship between pancreatitis and NSAIDs?
It's so funny as a non-medical person.
I knew I didn't know how to say it.
It was brilliant. So pancreatitis and NSAIDs, is there a relationship? Okay. And the answer is, I would have to research it again. I recall that chronic NSAID, what is NSAID? Non-steroidal anti-inflammatory drug. Ibuprofen, Motrin, Advil are some of the names. Those drugs are not benign, by the way. So they have an increased risk of coronary vascular events. They have an increased risk of kidney damage. they have an increased risk. Do they have an increased risk of pancreatitis? I feel like I recall that being the case, but I can't speak to it firmly. But it rings a bell in the back of my mind. So someone who knows can weigh in and let me know.
So Miss Goody Two Shoes said, Andy wants to know why you went live on YouTube.
Oh, Andy's here. Andy,
Diddy's Andy,
A Diddy is,
I've learned.
of course, he's Andy. So Andy is our biz dev master out of Boston. Why am I going live to YouTube? You know, Andy, I've been having a Z moment where I want to burn this whole thing to the ground and reform it in some different image. And Facebook, honestly, can I use the F word? They've been fucking with us lately. So the algorithm at Facebook has been bad. We're not reaching that many people. They're just not pushing it out. So they're kind of punishing video makers and stuff right now. So I'm like, you know what? If you don't love me, okay, I'm gonna go down the street to Google and YouTube and I'm gonna try that shit on YouTube because you know what? They appreciate me there. And so far, judging by the comments, it's on point, all right?
DevMaster would like to know, what do you think will decrease physician suicide rates?
What do I think, DevMasters, what do I think will decrease physician suicide rates? Number one, reduce the stigma about talking about mental health. Number two, it's isolation. This idea that we are suffering alone. Imagine if you're a room full of depressed people who are suffering some kind of moral injury working in a broken system, but they're all communalizing their pain. They're like, man, we're all in this together. They are not going to typically die by suicide because they're in this with others, in relation with other human beings. That's where humans need to be. When humans get cut off from others, we don't do well. Depression is an isolating disease. One of the warning signs of impending suicide is people cut off contact. They stop interacting on social media. They stop, talking to their friends, that kind of thing. It's one of the warnings that like the AI algorithms are starting to learn. So one of my pieces of advice is let's communalize our pain. Let's talk about this more and really say, this is not a stigma. And at the same time, we have to address the root causes, which are moral injury. It's this idea that we're forced to be in a system that's really effed up. We can't just take care of patients. My best days are I'm just taking care of patients. I don't have to write a big ass note, have to click the box in the EHR. I don't have to deal with some administrator. I just take care of patients and they're happy and I'm happy and it's wonderful. It's a connection. So we got to fix fundamentally the system and then we got to provide resources for our caregivers. And that includes stopping this process of asking on licensing exams, do you have any mental health disorders? Because that's going to assure you that people are not going to seek care because they don't want to have to deal with that on their licensing. So we got to fix that. That's dumb. Just saying.
Maylene wants to know, how do you know when a patient needs a medical or medical emotion from vaccine?
Medical exemption.
Oh, yes.
So it's probably an autocorrect issue. Yeah. How do you know when people need a medical exemption from vaccines? Well, I know when you don't. It's all the made up shit that these fake doctors, by the way, they're real doctors who are getting paid to give medical exemptions in California now because of the new legislation, which got the legislator, Dr. Stephen Pan, who's a pediatrician and a state senator, attacked on the streets of SACTO, the mean streets of Sacramento. Tomorrow is the day Stop Anti-Vax Violence is going to be the hashtag where people are going to rise up and be like, listen, bitch, you cannot hit another human being on the street because they are trying to save the lives of children. And also, you're crazy. So medical exemptions, what are appropriate medical exemptions? Now, again, you need a pediatrician to answer this, but just off the top of my head, anaphylaxis, so having a severe allergic reaction to a vaccine or a component of vaccines that's contained in that vaccine. Another medical exemption would be you have a immune deficiency or autoimmune problem or transplant status, something else where you cannot get live vaccine, in which case that's an exemption because it's a medical exemption. Those are just two exemptions right there. There are not a whole lot of other exemptions. So when you start seeing shit like, well, he's allergic to gluten, well, that's bullshit. So those are fake exemptions.
Fool says, hey Z, have you heard of the street medicine Very HC 3.0? It's been doing big things here in Portland.
Portland, huh? So you guys have this Very HC 3.0 Street drug? I haven't heard of it, but you know what? What happens in Portland stays weird in Portland. Hopefully it doesn't leave the town. But also, if you have any, send it my way and I'll snort it live on the show. If you guys send me money, because I only do shit like that for money.
Catherine would like to know how you feel about the new integrated residency programs and hour limits.
So I don't know much about integrated residency programs. By the way, is the audio good, you guys? I don't know much about integrated residency programs, but I do know about hour limits. And it's a mix. I have mixed feelings because we no longer take ownership of our patients. You know, back in the day, yeah, it was problematic. You're really tortured, but at the same time, most of the people who went through it would not have it any other way because they got to see the full continuum of care for their patients. There were less handoffs. Handoffs cause errors. They do. So we're introducing new errors. We're introducing new dangers. It's not a slam dunk answer for this. And I think that's why, we want to be humane to our trainees. The way we did it in the old days was crazy. If you've read House of God, it was brutal, right? But we have to come up with a way where people actually have continuity of care with fewer handoffs. And maybe that means, well, there's a lot of things it could mean, but we're going to have to do a separate show on exactly that. So Dev says there's still some static. It might also be that I forgot to turn off the, maybe I can do that now. Hold on. Bump. Are we back? There we go. I turned off my Bluetooth and my cell. Sometimes that can cause interference with this microphone. Let's see if that makes it better. I cannot have live vaccines, says Tanya. Does that make them work less effective? It depends on what you're talking about. So live vaccines or killed inactivated vaccine are usually that way because they're quite effective. So it really will depend on the vaccine and what you're talking about and why you can't have them. And so I would talk to my doctor on that because that would otherwise constitute direct medical advice to you, which I can't do because I go to jail. It is also, Kinpatu says it's not static, it's radio interference. That's the cellular and Bluetooth function, which I just turned off. So tell me if it's gone for good. Do you think the electronic health record will ever change significantly enough so that physicians have more patient interaction time? Jared. Yes, it will. It can't not. Because the current situation is untenable and we're going to start demanding change en masse. We may just even have to stand up and go on strike because we will not tolerate this bullshit. It's not just any particular vendor. It's the whole concept is backwards. It needs to be simple. It needs to be easy to use. It needs to be patient-centered and doctor-centered and not billing-centered. And until we actually change how we pay for medicine, I doubt any EHR vendor is going to get it right because they're not incentivized to. You know, they're paid to be billing machines. So we have to fix it. Do vaccines cause all sorts of health problems? Martin Simpson, yeah. They cause terrible health problems, like living long enough to watch your kids graduate from school or living long enough to see your kids have grandkids. Or not being paralyzed and having limb length inequality because of polio, or not getting shingles, which is tremendously painful and can potentially be debilitating, or not dying of meningitis and having permanent deafness or disability. Those are the complications of vaccines because vaccines cause adults. When are you going to collab with Chubby Mew, the case study YouTube doctor? I don't know this guy, Chubby Mew, Nikki T. You tell me who this person is. You tell them to collaborate with me because I'm Z-Dog Frippin' MD. All right? Hi, Dr. Mike. What? How many people? We got 153. Like the audience actually growing.
I know.
Read some more comments. What do we got?
So Brittany, since you're talking about shingles, she said, if you've had shingles in your 30s, would you recommend getting the vaccine after?
If you've had shingles in your 30s, would you recommend getting the vaccine after? So people say yes. They do say yes, but I would talk to your specific doctor because I cannot give you specific medical advice, okay? But that shingles vaccine, the newest one in particular, which is hard to get and expensive right now, is the bomb diggity. Like it actually works hella good. What do we have here? Are we in agreement? are in agreement with consensus that homeless situation will result in epidemic disease outbreaks. Geez Louise. I don't think so. I think there'll be outbreaks, but not epidemics. So you'll have an outbreak within a homeless camp. Hepatitis A is a prime example where it's spread, poor conditions, crowded, and being homeless, right? So, but I'm not really sure about epidemic. Now, what will trigger epidemics are overcrowding and poverty in the third world, developing world, where you end up eating bush meat or something, getting a viral illness that then spreads as a pandemic. That can happen. Yeah. What we got?
So Felix Cat says, we have urgent care for physical health. Where is the urgent care for mental health?
Oh, there's urgent care for physical health. Where is the urgent care for mental health? We did a show on this with Denise Brown of a company called Vituity. You can search it, Vituity, and on zdogmd.com or on YouTube, you can find that interview, Denise Brown, ZDogMD. There is a behavioral health crisis right now in urgent cares and ERs. They are not equipped to take care of people with mental illness acutely. They just aren't, but they can be. And it's as simple as sometimes it can be a telepsychiatrist who beams in and is able to manage things. Sometimes it's simply providing a quiet, calm space where patients can be as they're treated, as they're managed, so that they're not in the zoo of the regular ER that just makes everything worse. Reimbursements aren't great. There's a lot of things that can be fixed that can fix the behavioral health crisis in the ER. So it's actually a great question, and I would recommend you watch that show. I have a thingamajigger here that I can't play with.
Jayra073 asks, what do you think about physician informaticists?
Physician informaticists? Is that what it is?
Yes.
So it was physician?
Yes.
Oh, okay. What do I think of physician informaticists? So these are, if I'm understanding the question correctly, these are doctors who then go into informatics. I have good friends who do this, Topher Sharp at Stanford, others who are leaders in the sort of chief medical information officer space. So it's really about studying and understanding how technology, information technology, data analysis, everything interfaces with the clinical practice. And I think it is actually a very important field of study because it also involves usability. And when we make usability better, then everybody's lives get better. We decrease burnout and clicks and all of that. So I'm all for physician informaticists.
Manny asks, what do you think of Watson taking over radiology?
What do I think of Watson taking over radiology? Asked Manny. Okay. My wife and I, my wife is a radiologist, have this ongoing bet. And I have told her that radiology will be replaced with AI within 5 years. And she has the bet that it will not be within our lifetime. We're in our 40s. So another 40, 50 years, depending. I'm planning to die at 50, quite frankly, because anyone older than 50 is a punk-ass bitch. But my wife thinks it's going to be not in her lifetime. Now, why does she feel this way? She feels this way because she is an academic chest and cardiovascular radiologist. She sees shit that requires a degree of intuition and human input and integration that she does not think a computer will be able to do in this foreseeable future. I think that you can give computers enough data that they can start to infer and make these connections that humans cannot. And I, for one, am desperate for the day that that happens. And I'll tell you why. And this is something that's going to get me hella shit. People are going to be pissed, and I'm probably going to lose speaking engagements, but I don't give a fuck. So here's the thing. Most of what we do in medicine is abject horse shit. It's not proven. It's riddled with human error. We make mistakes constantly. We rely on our gut, which succeeds many times and sometimes fails. We're flawed. We use flawed heuristics and shorthand, which is why we treat black people, women, minorities different than others, because we use these shorthand heuristics that fail us. Turns out computers could do this shit on a level that you can't even imagine, you can't even wrap your head around. They can do the heavy lifting of that stuff that then allows us to do the highest level intuition, non-iterative intuition that only humans can do. I am dying for that day as a patient and as a healthcare provider, because it means we will get to do what we do well as humans, and we will be less prone to mistakes, have better quality. And so if that involves replacing most radiologists with AI and leaving the hardest, most academically complex cases to an AI-assisted human, by the way, that's another thing. It's a pet peeve of mine. AI doesn't replace humans. It augments humans in most cases. Technology should augment humans. It's not a replacement. And then you have Andrew Yang talking about, well, the AI revolution is going to put people out of jobs, and so we need to provide universal basic income. I think that's horseshit. We've said that for decades about technology, and it's never been true. What's different about AI? Oh, everything and nothing. So I actually think AI is just another beautiful tool we humans, who are awesome and also terrible, are going to use to improve the world. If it doesn't destroy us first, or we don't destroy ourselves. We're more likely to destroy ourselves. Did you people see Chernobyl? Jesus Christ, it was terrible. I'm like, the Russians, you're going to trust the Russians with nuclear shit? They don't care. They're a bureaucracy. Sorry, I get it.
Michael wants to know, what's the deal with chronic Lyme disease? Is it real or a misdiagnosis? You seem stressed.
Chronic Lyme disease. See, this is the thing. I don't tell her. I'm like, don't read comments about chronic Lyme disease, because when I read them, I'm like, because I'll tell you why. That is a morass of just filth. Like chronic Lyme disease, whether it's, okay, there's debate. Is it real? Is it not real? Are there a bunch of quacks out there treating it, or are they treating other, like chronic fatigue or other things that like nobody really understands? Here's my take. We just don't know, but most of the people talking about chronic Lyme are full of shit. That doesn't mean it's not real, but it means that most of the people talking about it are full of shit. It's non-scientific stuff. There's not evidence. There's a Dunning-Kruger effect going on, where people learn a little bit about it and then they think they know everything, but they don't know what they don't know. And if you talk to infectious disease people, they're like, So there's something else going on with those patients, or it's some kind of Lyme-related thing, but it's in a way we haven't wrapped our heads around. And throwing a bunch of antibiotics at it, probably not the answer. But that's just me, people. Don't hate the game, hate the player. The player's me.
Rashad wants to know, what is your take on value-based purchasing and ACOs?
What's my take on value-based purchasing and ACOs? So accountable care organizations. In theory, that is what that means, is that's a group. Jesus, what kind of questions are these? Who are these YouTube people?
They're pretty smart.
They're really smart. Like, God, seriously, you guys, you should pat yourselves on the back. Like on Facebook, it's like, tell me what toothpaste do you use? Do you wear boxers or briefs? I'm like, I would expect that from YouTube, where the average age is 12. So accountable care organizations were something that kind of arose in an academic environment around the Affordable Care Act. And what it says is, let's get a bunch of people together and let's hold them accountable for a population. So instead of managing individuals, you're talking about managing a population, keeping them healthy, and using tools like data analysis, claims analysis, pulling stuff out of the EHR to see where are they going, how can we better manage their care, and have the outcome be less expensive care with better quality. And then you get paid more, you get a piece of the savings if you're saving money on that population. So it incentivizes you to get more case management, to get more care coordination between primary care, specialty, but the main incentive is to avoid something the business people call leakage, which is not diarrhea, although it sounds like it. Leakage is where your patient goes outside of your network to get their care, and therefore you are hemorrhaging money. And so much of ACOs is trying to avoid leakage, and so far the data doesn't show that they're very helpful. In theory they work. In practice, it's very hard to change the culture, to change expectations of patients, to coordinate care, and to do it all with an EHR that's a piece of shit. So yes, very promising. Yes, we should try things like that. No, it's not working yet. So, and this idea of shifting from volume, where we get paid to see as many patients as possible, to value, it's a great idea, and we should try it. At Turntable Health, at our clinic, we did try that, and it actually does work. The problem is people have to be willing to burn your previous bridges. So no more fee for service, no more, price gouging. That's a hard drug to quit. So most organizations won't do it, and that's why ACOs are not successful, partially. These are great fucking questions. Who are these people?
Vivian wants to know your view on psychedelic medicine now that psychiatrists are studying the effects and treatment for alcohol dependency and other things.
So I don't know, you guys, let me know if you can hear Victoria because I have this tiny mic when she's telling the questions. So I'll just repeat them to be safe. That was a great question. Z-Dog, what are your thoughts on psychedelics given the recent data on alcoholism, depression, and psychiatry? All right. This is something I'm passionate about, and I will tell you why. In college, I dabbled in psychedelics, LSD, psilocybin, mushrooms, that sort of thing. Tom Heineber, our producer, has done all those and DMT in smoked form. Both of us have had experiences with those drugs that you can only really define as mystical experiences, meaning you have seen some aspect of reality where you're absolutely convinced afterwards, even though it was a drug, this was a real thing, and your mind reboots. Now, recently, Michael Pollan, who's written a lot of great books, New York Times guy, wrote a book called How to Change Your Mind about psychedelics, and I read it with rapt attention. These are stigmatized drugs because of the 60s, because of people like Timothy O'Leary. Yeah, Tim O'Leary, right? Timothy Leary. He got rid of the O because people were racist against the Irish. Tim Leary really made it like a recreational drug, and I think people with psychedelic drugs, you need a guide who's trained, you need the correct dosage, you need set and setting, meaning you go in with the right mindset, which is I'm here for a therapeutic intervention. Things could get scary. I run towards them rather than from them. I'm with someone who's going to keep me safe. And the setting, meaning where are you? If you're out, in a crazy place, shit could go wrong. In those settings, the data increasingly at Hopkins and other places seems to show that psychedelics are tremendously transformative for patients with treatment-resistant depression, PTSD, alcohol, and, as Michael Pollan says, for the betterment of well people, people who are normal, but fucked up in a normal way. So they just need a spiritual reboot, for lack of a better term. They need to re-see the world through fresh eyes, get rid of some of the baggage and the self by calming what they call the default mode network in the brain. These drugs do that. I am a huge proponent, not necessarily of legalizing them recreationally, but of using them therapeutically. And that includes MDMA or ecstasy or Molly, as the kids are calling it. That is a tremendously powerful drug for PTSD, depression, phobias, all these kind of different interesting things. So I'm a believer in this stuff. I'm not saying kids go out and do these drugs because you can die. All right? What do you think? What time is it? Where are we at?
It's 5:26.
5:26. All right. We've talked for 43 minutes. Dan says ketamine. Yep, another drug we can talk about. I got some claps from Ms. Goody Two Shoes. Jared has, people are talking to each other, which is great. Dude, this is fun. So let me know. Should we do more YouTube stuff? Because I'm thinking yes. Because and one thing, if you guys want to support the show, you can send little bits and bytes of money here, but you can support us on Patreon. You can also support us on Facebook by becoming a supporter. You get access to a little private group on Facebook. So that's a way to use Facebook that does not suck. And I usually go live to the supporters almost every night. It's a great conversation, but this has been really great because the Q&A really keeps me on my toes and it's fun. And I love you guys. So let's see. We hear a lot of yes from Ashley Stewart, who's also, I believe, a supporter on Facebook. Hell yes, a lot of yes. Physicians using modafinil. Ooh, Kais, that's another day. $2 from Rashab Chawla. Thank you, Rashab. I appreciate your support. We're up to $10. Melissa Big Mac hit us with $10. Thanks, Z. Oh, and Melissa, I bet I know which Melissa this is. She's one of my favorite supporters. Thank you, Melissa. You're really generous. It really does. It's humbling when people want to support what you're doing. It really is. And we use it to buy fake plants, hire people that don't suck, have lights, and also buy hookers and blow. Because people, let's be honest, I'm Z-Dog MD, okay? I need hookers and blow. I have neither, and I need neither. I love you guys. Thanks to Victoria for moderating this. And we out. Peace. Now, how the hell do I end this? Let's see. Do that. Oh, that won't do it. Whoa, somebody just sent me some money. Thanks for the New Zealand money, Jordan McGregor of the Clan McGregor. Thank you, Jordan, for your money.
They want more Vader.
You want more Vader? Oh, you'll get... let's go live to YouTube on Force Friday with Vader. That will be fun. Oh! Victoria can read the comments because the reason Vader doesn't like to go live is his robot eyes don't see this very well. Hey, Katie. They don't see it very well. So if she can read comments, Vader can respond, and that's a thing. You guys are brilliant. I love you. Now I want you gone, but I don't know how to turn this off. Let me see if I do this.